we have a special modifier to notify that. You need to report the ASA code with the modifier QS to show that the type of anesthesia is MAC. Or sometimes we also have like other modifiers called G8 and G9. These can also be used to show that the person is being subject to a MAC type of anesthesia. So you are not supposed to use QS or G8. You are not supposed to use QS and G modifiers at the same time. Either use a QS or you will have to report a G8 or G9 depending on the presence of a cardio or the pulmonary condition. We all know about modifiers. There are so many modifiers that we have encountered in the surgical part of the CPT coding. Here again, in the anesthesia part also, there are certain modifiers. Please understand, these modifiers are strictly only for anesthesia codes and not for the other CPT codes, because the surgical modifiers are different and the anesthesia modifiers are different.